here to talk about a useful reference tool we've developed for those attending today. All the provisions we've discussed, plus a few additional ones, a law synopsis, and the possible impacts to child support are included in our Child Support and Healthcare Reform Analysis. You can print this reference tool from www.hms.com/webinars. Our healthcare reform bill analysis is, of course, an evolving document, so please feel free to email me with your thoughts or comments. Before we take your questions, we want to leave you with a few closing thoughts. Healthcare reform will expand the availability of private healthcare coverage for children on the child support caseload. Health insurance exchanges should coordinate and exchange data with child support agencies in order to properly assess and enforce medical support orders. Child support agencies should be included in state-level implementation of healthcare reform. This is not the time to be passive. Decisions being made at the state and federal levels will impact the way you do business. Child support has a role in healthcare reform, and you need to have a seat at the table. Feel free to contact either Erica or myself at the email address on your screen if you have questions. We would love to hear from you. Thanks for your time. Now here's Linda.
Thanks, Barb, and thanks, Erica. Now let's take your questions. Again, if you'd like to ask a question, please use the Send Question to Staff feature on your control panel. If you're having trouble seeing your control panel, just left-click on the arrow at the top right of your screen. Okay, here's our first question. Can you give an update on what's currently happening with the Affordable Care Act? With the change in Congress and the lawsuits, is there a chance it may be repealed? Erica, would you like to take that?
Sure, Linda. First, what I would say is that it's very unlikely that the bill will be fully repealed, or I should say the law will be fully repealed. After the November elections and the Republicans gained the majority in the House, there's a lot of talk about repeal and replace. And as a symbolic gesture, we saw that the House representatives did hold a vote, and it passed. However, when the bill went to the Senate, because the Senate is still held by the Democrats, that bill could not overcome some procedural hurdles, and it failed. So in terms of a legislative effort to repeal, that's pretty much dead at this point. What we see congressional Republicans doing now is more of a plan B, where they're trying to pull various legislative levers to withhold federal dollars from implementing the law. What I think we'll likely see are there's some changes made to the law. We were already seeing this week the 1099 reporting requirement. That may be changed and altered, but what will really have to occur is that any changes will have to be bipartisan. And I think what we'll also see is just both parties will drag this issue out into the elections in 2012, and we'll see what really happens then. It's also worth mentioning that in addition to some of the legislative efforts, there's certainly a lot of activity going on in the courts. Right now there's about 20 or so different lawsuits going on that are questioning whether or not the health care reform law is constitutional. A few courts have upheld the law, a few courts have dismissed cases, and a couple of courts have said that the law is unconstitutional. The case that tends to get the most attention is the Florida case, which consists of 26 states. And as most of you probably know, recently that judge said that the law overstepped the congressional power with the individual mandate, and that because the individual mandate is connected to the whole law, the law as it currently is written cannot stand. Right now that's going through a repeal process, and we'll see what happens. But one thing I would say, which is kind of interesting with everything that's going on, is that with all the states that are involved in the lawsuits, I think there's almost 30 or so, we're seeing that many of these same states are also receiving federal funding to implement legislation. And we're seeing lots of executive orders and legislative bills that are being passed at the state level to implement health care reform. So with everything that's going on, what I would add is kind of a little bit more color is that we're seeing states still moving forward. So I would not, I don't think anyone should really be halting their efforts due to what's going on in Congress or in the lawsuits or in the courts at this time.
Great, thanks. Thanks, Erica. Okay, we have another question. What do you think will happen to medical support enforcement? You made some good points today about opportunities, but there are some that say that it may go away altogether because of health care reform. Barb, that sounds like it's for you.
Yeah, this is a question that's come up a few times, especially at the February NCF policy briefing in D.C. And as most of us know who work in medical support enforcement, there's still just a lot of unknowns as we wait for guidance and new regulations. But my view is that healthcare reform, you know, for me, it really represents new opportunities to establish and enforce medical support orders. The discovery process should be easier since more information on coverage and costs will be tracked. And also, you know, more parents will have employer-sponsored insurance because of the individual mandate and new employer requirements. And I think what will be key to ensuring that the importance of medical support enforcement is not overlooked in healthcare reform is just getting that seat at the table like we suggested. We in the world of child support should understand how exchanges will work and how the IRS will enforce the mandates and verify coverage. So again, I think there are a lot of new opportunities to renew medical support enforcement. We just have to put our collective heads together and identify what we want to do. One thing to note that might be overlooked by some state agencies is that in the President's recent budget proposal, it's found within the CMS legislative proposal section. It includes language to strengthen medical support enforcement and collecting medical child support where health insurance is derived from a non-custodial parent. So this indicates to me that medical support enforcement just is not going to go away.
Great, thanks, Barb. Okay, we have another question. How would you recommend state child support to get involved in the state healthcare reform committees and councils? Barb?
First, I suggest you talk with your state Medicaid counterparts about your desire to include child support in the healthcare reform discussions. They're your counterparts in the state. You're dealing with children that are dual eligible. They're in your program and theirs. So I'd go to those people first. But also in almost every state, there is some kind of, there are healthcare reform websites where they post their activities to date. So I would suggest spending some time on the website and maybe even if you're allowed, attending one of the up-and-coming meetings or even requesting a meeting with the council or group to talk about child support's role going forward. If you need any assistance finding out about the activities in your state, just let us know and we'd be happy to help you find more information.
Great, thanks, Barb. Here's another one. Could you repeat where we can find out where the handout is listed at the end of the presentation? Yes, I'll take care of that. The handout is going to be posted on HMS's website. It's www.hms.com/webinars. Okay, let's see if we have any other questions. It says, will you be providing a copy of the presentation? I think that probably was just answered. You can find it on the website. And if you have other questions, you could contact Barb. There'll be an email address at the end that you'll be able to reach her at. Is HMS available to give presentations like this to state work groups working towards developing exchanges? Barb?
Oh, yeah, we'd love to come out. You'll get my email address at the end of the presentation. So, yeah, give me an email, give me a call. I'd love to come out and talk to you. Right, Erica? We can get on a traveling show.
Of course.
Okay, here's another question. Do you know of any state that has included child support in their discussion of solutions? I'm not sure. Erica? Barb?
We talked to a lot of states. We've been meeting with a lot of states regarding health care reform, and to date, it's just something that I don't think is really on their radar screen, and that's why we're really encouraging child support agencies to get involved in the discussions that are occurring at the state level as states try to determine, what their next steps are in terms of solutions and implementation of health care reform. So I'm not aware of child support really playing a huge role in terms of some of the healthcare reform implementation documents and proposals and recommendations and solutions that I've seen at the state level. But I think that's why it's even more imperative that child support, bring themselves to the table.
Great. Okay, we have another question. You indicate we should exchange information due to the Healthcare Reform Act. But how can we do that following the new safeguarding regs? Barb, is that?
Yeah, that's for me. That is something that Vicki Turetsky's talked about at the conferences that she's attending. They are working closely with CMS to look at confidentiality regulations and trying to overcome that obstacle. So that's why I put it on, I talked about it today, is just keep that on the radar. Keep asking OCSC to overcome that hurdle. I think it's a big one, and it's important to us. So we need to encourage the federal office to not take no for an answer.
Great, thank you. Okay, I think that concludes today's webinar. I want to thank everyone for joining us. If we didn't get a chance to address your question, we will be getting back to you soon with a response. Please be sure to check out our website often, www.hms.com/webinars, for information about future webinars as well. And thanks to everyone for attending today.